Malcolm Skingle. I worked for GlaxoSmithKline for more than half a century. I joined from school. The first 20 years of my life I was a pharmacologist in a very successful pharmacology department that developed half a dozen drugs that are still sold today. And then for the last 30 years I've looked after academic liaison, a team in Philadelphia and in Stevenage, and I've enjoyed every moment of it. I've worked with science-driven organisations like Diamond and universities around the world to set up collaborations on behalf of GSK scientists. So I've been engaged with Diamond for more than 20 years. It was actually David Clark from the Engineering and Physical Sciences Research Council asked me if I'd consider chairing their Industrial Advisory Board. And I said, but I'm a pharmacologist, what do I know about big physics? And he said, well, you're just the right sort of person. I said, how's that? He said, well, you will ask those questions that the experts want to ask but feel they can't. So as a generalist, I kind of think I've been helpful. The very first meeting that I had here it was so long ago, it was actually in a porter cabin because this was still a building site. They were still building the synchrotron. And from those days, it's just got stronger and stronger. And because industry were engaged at a very early stage, it's meant that we've inputted and actually we've made Diamond a better facility for addressing our needs. Been asked how Diamond has impacted for industry. When you think back 20 years ago, you had 3 8-hour shifts, and the scientists in companies like mine used to save up their crystals, and then 3 or 4 of them would go off to a synchrotron to analyse their samples. Some would have that night shift, the dreaded night shift at midnight, working through the night that they all hated. When I think how far we've come, because we've taken best practice from industry into Diamond, into the synchrotron, and we've probably got the most, well, we have got the most efficient operation now for MX, for crystallography, probably in the world. And that's because it has the robotics, has the FedEx system, has various options whereby you can quite easily send your samples or change your samples even from your back bedroom remotely. We just made it so it's so much easier to use. The other thing that we get from Diamond is obviously the massive amount of publications and the number of protein structures which are solved and put into public databases. So we were, as a company, the company I work for was heavily involved in the Structural Genomics Consortium. That could not have been done without Diamond and other places like Diamond. Similarly with AlphaFold, you know, we just had the Nobel Prize for AlphaFold. That, the strength of AlphaFold is only as good as the data that's been used to train it. A lot of that data was generated also by the scientists, the beamline scientists at Diamond. When you think of the companies, the politicians always want to know which sectors and which companies are helped with Diamond. Well, certainly the large pharmaceutical companies, AstraZeneca, Pfizer, GSK, they all use Diamond effectively. But when I tell you that quite a high percentage of the revenue coming into Diamond from companies is from SMEs, I think that also speaks volumes. And then you have the clinical research, the contract research organisations in between, which fill that gap. And that's just life sciences. And then when you look to Rolls-Royce, you look to the engineering side of things, you look to the soft condensed matter side of things from the foodstuffs. Diamond does a great job in supporting industry through their industrial liaison office, which is driven by Elizabeth Shotton and her team. What differentiates Diamond and gives it such impact for industry is the openness and the transparency of the industrial liaison team, but also the beamline scientists. So rather than have to deal with some bot or some automated telephone system, you actually pick the phone up and talk to a person. You can describe your scientific challenge and they will pull various techniques together, because it's not always the same technique, quite complicated physics to give you the best answer to your scientific challenge. And I think that can-do attitude and that openness to collaborate is what really differentiates the Diamond staff, frankly, from some of the other groups that I work with. But I have to say that Diamond staff have always been responsive. That's their #1 primary asset. their flexibility, their can-do attitude, wanting to help, and also being knowledgeable, because they're all scientists themselves. So I would say my biggest legacy as chair of Disco has been working with Elizabeth Shotton when she arrived, which was 3 years after Disco started, but for the last 17 years working closely with Elizabeth and her team to pull in different sectors, consider different types of technology and ways of using the beamline, and to maximise that to the best of our ability to draw people in. If you have a look at the revenue coming in from industrial research, who are not altruistic, we're only going to pay for things that are valuable, it's gone up year on year. And that's because of the openness and the transparency and the flexibility of the group, which comes through every time I meet her or anyone in her team. What really excites me about Diamond's future, obviously the Diamond 2 and the upgrade, a brighter, more focused source, state of the art. I mean, already the science here is unbelievable. But I think the fact that aligning many of the projects to some of the ambitions of the government, certainly what DSIT and what UKRI want to achieve, is obviously a very sensible thing to do. When I look at the portfolio of projects that are currently being undertaken at Diamond, I mean, most of them map onto, not surprisingly, on the government's ambitions. So I think the future is rosy. I mean, the number of publications that come out of this place, the number of collaborations and collaborators that they've pulled together. I'm really looking forward to not only staffing Diamond using the different beamlines to address certain scientific challenges, but also pulling in the other STFC funded centres that are available at Harwell and elsewhere to actually pull those different techniques together, to bring the different disciplines together to address the really large scientific challenges that no one single organisation can actually look after. In the pharmaceutical industry, 20 years ago, we thought we probably had all the technology we required to prosecute what we needed to do to develop new medicines. And then we realised actually you have to partner with people, and we collaborate with our competitor companies. But increasingly we work with more academic institutions and more research centres of excellence like Diamond, which is sort of the jewel in the crown for the United Kingdom.